reference in Africa and around the world. Still in the implementation and the launching of the AFCFTA by January 1st, 2021, we also need to really get a very deep understanding and very cross-referencing on the backdrop, on the context, which is the COVID-19 context. Against this backdrop, we need, in general, to make sure to have the AFCFTA work for the poor, not to leave anybody behind, especially women, youth, and the informal sector and the rural population, who should be the main actors and main beneficiaries of whatever we do in terms of trade and investment. Against the backdrop of the COVID-19, we need also to appeal to the toolbox available within the trade policy in order to really address some of the core issues in terms of public health, in terms of access to medicine, and in terms of industrial capacity building for the pharmaceutical sector. And we also have good news here. The good news is that not only at the level of WTO we have this Doha Declaration since 2001 on public health and access to medicine. We also have, for the first time, modification of the TRIPS agreement in order to domesticate the flexibilities that have been internationally now recognized under the TRIPS agreement, in order to really allow parallel imports, to allow for regional capacity building, to allow for compulsory licenses, to allow for a lot of policy space tools that will really ease the difficulties in terms of public health and access to medicine. And we need to make sure that also the FCFTA domesticate all of these flexibilities, but not only that, implement for the benefit of the African countries, especially for the ECOWAS countries. During the last summit on September 5th in Niamey, we had a decision by the head of state and government of ECOWAS that really appealing for increased access to medicine, and more importantly for the industrial capacities in terms of medicine to really reduce the level of dependency vis-a-vis imported drugs, and also to have manufacturing generic product in Africa, in West Africa, and we need to have this duplicated at the level of the continent, at the level of AFCFTA. And what we'd like to propose is to have ECOWAS named as a champion for a new program that we call Access to Medicine Program, Capacity Building and Industrial Pharmaceutical Capacities Program, in order really to alleviate the burden of drug importation, and also to make sure that at least at the regional level we have pooling resources for not only importing but for mainly fabricating, manufacturing the drugs, be them generic products, medicine, be them patented product, but to have a sufficient level of production, of manufacturing that will be commensurate with the expectation, especially in this pandemic era, especially in this very context where we are talking about availability of the first ever vaccine for COVID, and we need to question the issue of access, we need to question the issue of availability, we need to question the issue of price, and for African countries, for poor countries, really to make sure that nobody is left behind in the cure toward COVID. But more importantly, what we mainly have in Africa, which is the neglected diseases that have to be also addressed. And luckily, we have at least legal tools and institutional tools that need to be implemented, and we appeal that also the AFCFTA be part of the solution in make sure that we have human capital, but we have very healthy and ultimately a very wealthy human capital in Africa.